This is CBS 11 News at 10.
Technology is designed to make our lives easier, and with a new change in the medical community, it could also make you healthier. As two families explain, it could also save your life.
He came home and he slammed his door and said, I'm not coming out until you sign me back up for football. I don't care about my brain.
Carlin Evanoff's son Garrett was born with a brain deformity. Surgery in Seattle could have been an option. Garrett's files, though, were in Anchorage.
He watched me on the phone for probably 6 hours trying to get a copy of his study that we needed, and he just said, like, Mom, why don't they just send it express mail? Garrett, because they can't. It won't get here fast enough. And I didn't really have a good explanation. I just said, I'm sorry.
If the hospital in Seattle was part of the new health information exchange, Carlin would have been able to get the answers she needed for her son. The exchange is electronic file sharing between doctors and hospitals.
The field of medicine is really behind in capturing technology and the use of technology to improve access to that information. You know, you can have a test done at one center and it could be really difficult for me to try to get access to that. So it could lead to me needing to repeat the test unnecessarily, delay in having important information that could help you at the time that you're here.
The new health information exchange could have also prevented what happened to Rebecca Madison's 90-year-old father, who was being treated for diabetes and heart issues.
There was an interaction between two of the drugs he was taking, but neither doctor knew that the other doctor was prescribing that drug because Dad didn't tell him.
Here's how the exchange works. Your health information is sent out as an email attachment to the doctors who need it.
Both the attachment and the email are encrypted. So if it were captured en route somewhere, the email and the attachment are separately encrypted in separate ways, so you couldn't, even if you did hack the email, for example, you probably couldn't read the attachment.
Not even your doctor can share your information with just anyone.
They're not going to share information with the doc down the street because they're friends. They're going to share that information with the doc down the street because they're referring you to him or her. You know, so all of the same rules that exist today apply. All that's changing is the transport.
That change would have made all the difference for Carlin and her son.
It's the future of healthcare, and so the faster that we all support it and get on board, the better it's going to be for us, for our kids, for their kids. So just my own experience. Oh, yeah. It didn't, nobody died, but it sure felt like it. Sure felt like it at the time.
And you don't have to participate in the health information exchange. You do have the right to opt out. We've got more information under on-air links at ktva.com. And after the